This is Dr. Sudha from Team Lemoius. Today we have Dr. Anuja Bharati, a DMP pediatrician from Rainbow Hospital, Cholingnallur. So, as we all know, diarrheal disease being the second most leading cause of mortality in children, which is both treatable and preventable. So, today she is here to discuss about diarrheal diseases in children. Ma'am, may I have your short introduction about you?
Yeah, hello everyone. I'm Dr. Anuja Bharati. I'm GNB Pediatrics, and I also have a certified course in Vaccine Trust from International Pediatric Association. And currently, I'm working as a senior consultant in Rainbow Children Hospital, Cholingnallur.
Okay, we are glad having you here. Okay.
Thank you. Thanks a lot.
Yeah, so let us quickly get into the topic. What is basically diarrhea means, ma'am?
Okay, diarrhea, a very common term is loose motions, which parents come with a complaint of. But medically, diarrhea is 3 or more than 3 loose stools each day, or currently whatever the child is passing every day, if it is double of what he passes as a routine basis, that is also a diarrhea. Third, if there is a change in the consistency of the motion, even a single motion but completely watery, that is also a diarrhea.
Okay. So what are all the common causes of diarrhea in children?
So there are many causes of diarrhea in children, which is broadly divided into 3 kinds. One is watery diarrhea, second is inflammatory diarrhea, and third is the diarrhea related to malabsorption, where the food is not getting absorbed in a proper way. So among all 3, the cause can be a viral, it can be a bacterial, it can be traveler's diarrhea, where because of the traveling it has happened, it can be because of some indigestion resulting in diarrhea. Sometimes a particular allergy to the food also results in diarrhea. So the causes, if we see related to the infective diarrhea, 90% of the diarrhea is because of the virus. 10% is because of some other infections, where it can be a bacterial or it can be some other reasons.
So what are all the classification of dehydration in children, ma'am?
Okay, so this is a very important question, because when a child comes with a diarrhea, for us as a pediatrician, diarrhea is not something to take call for and is not at all concerning for us. The more concerning point is the child should not be dehydrated. So the main criteria is no dehydration, some dehydration, and severe dehydration. No dehydration means the child's hydration is completely okay to be managed at home, where we can just go for mouth remedies of ORS, coconut water and all. Some dehydration is when the child has some signs of dehydration, where he is a bit dull, sunken eyes, dry tongue, decreased skin turgor. These things are signs of some dehydration, where we either manage by orally if the child is able to take by mouth, or we manage by IV fluids. And third is a severe dehydration, which is definitely an emergency condition, where the child definitely needs intravenous hydration therapy. In severe dehydration, the child can be seen completely lethargic, not responsive, completely not responding to any commands, completely dry. Those signs of severe dehydration, when you see the hands and the legs, when you touch, it will be completely cold. Pulses won't be well palpable at home. These signs are of severe dehydration, where you should emergently bring the child to the casualty and get the management done as soon as possible.
Okay, ma'am. So this is how a parent should identify the severity of diarrhea, right?
Yes.
What are all the indications for deworming in children?
Okay, usually we say that deworming should be done in a lifetime, because it helps the child or the small kids to get rid of the worms in the stomach. Usually it depends on the age, whether the child is less than 2 years or the child is more than 2 years, about the dose for the deworming medicine. Okay. When we do a deworming, usually it helps the child to have a better appetite, to increase their blood, especially the hemoglobin. Now there are some indications when we need to repeat the deworming medicines, like if there is any worms in the motion, if you have any itching in the motion area, your appetite is completely gone, or when you see your child is licking on the muds, chalks, walls, etc. These are signs, or the child is getting pale and pale with all other reasons ruled out. We should always think about deworming, definitely.
What are all the do's and don'ts for diarrhea in children, ma'am?
Okay, so most important, we'll go with the do's first. So it depends on the diarrhea. You have to see first your child is hydration wise, how is the child? Whether your child is well hydrated or your child is not hydrated. If your child is well hydrated, taking by mouth very nicely, make sure to give plenty of fluids. A common mistake parents do is they push their child to eat even when there is a diarrhea. You should not push your child to have solids when there is a diarrhea, especially when they are not willing, because at that point of time, the important call is to have plenty of fluids. When we talk about fluids management in diarrhea, most important is ORS, which is oral rehydration solution. This solution is a mixture of different electrolytes with sugar combined together, which can nourish the body, the water which has the body lost during diarrhea. It can be ORS, tender coconut water, buttermilk, and of course plain water. This is most important when your child starts with diarrhea. The moment the child passes one episode of loose stool, you should replace it by mouth giving any of these solutions.
Okay.
Don't give your child milk or any fruit juice when the child is having a diarrhea. Why? This is because when you give a fruit juice or a milk, the diarrhea is going to aggravate and it pushes the recovery of the child from loose motions.
Okay.
Related to solid food, when your child has a diarrhea, try to stick to rice-based food. It can be anything: rice kanji, idli, plain dosa, curd rice, banana. These are good food and fruits to control the diarrhea. You should not go into salads and roughage diets, which are ideally advised for constipation. It again pushes the recovery of the child from loose motions.
Hope this will be very much useful for the parents.
And last but not the least, very important, when your child has a diarrhea, you should always look for any blood in motion, because that is a very important demarcation between the child whether to start an antibiotic or for not to start an antibiotic. If there is blood in motion, definitely it shows there is some bacterial infection in the gut which needs an antibiotic. If there is no blood in motion, we should not start with the antibiotic from day one, which we see mostly many people practicing at the present scenario. Almost 90% of the diarrhea in kids is a viral diarrhea, which will be self-limiting by its own. We just need to add some supportive treatment for a better recovery.
Ma'am, do you have a take-home message to tell for diarrhea in children?
So the most important take-home message for diarrhea is hand hygiene. So when your kid is having a diarrhea, the most common reason is bad or unhygienic conditions, unhygienic food habits, or unhygienic hands, sometimes unhygienic surroundings resulting in. So make sure the hand hygiene is properly maintained to prevent diarrhea. And second, if the diarrhea starts, don't panic. Start with the ORS, buttermilk, coconut water. Don't give any milk or fruit juice, and make sure your child's hydration is at par. If at any point of time you have a question mark related to your child's hydration, definitely see your pediatrician.